Hello, I'm Bruce Stevenson. I'm going to try and demonstrate how to use our payment options, which are available on our website, and which are a very convenient way to show patients which particular ways they can pay for dental treatment in your office. So I have two patients here. The first is Mickey Mouse and the other is Donald Duck. Now I'm doing this from within Open Dental, but you don't have to do this from within your practice management software at all. You can use this as a standalone payment options form. So I'm just conveniently going to show you the way we normally do it, which is from within Open Dental. I'm going to select the patient. I'm going to go up here to letters and merge. And I have a list of all my different documents that I have here as Word files in Open Dental. So I'm just going to pick this first one up here because it's the one that we most commonly use for Invisalign and click on Preview. And now down here, a Word document is going to pop up right there. This is the payment option sheet. The payment option sheet is a combination of a Microsoft Word document with a Microsoft Excel document. The Excel document, I'm going to show you in just a second, is embedded in the Word document. Now, because I called this from within Open Dental, it automatically put in the patient's name. You can easily fill in the patient's name yourself. You don't have to have this integrated with your practice management software. So in this particular payment option sheet, which is set up for Invisalign, we can see here what the patient's payment options are. We have those already set up in there for the patient. So now we're going to go in. We also have the treatment discussed in here. Okay. The other one I'm going to show you in just a second, we're going to have to put the treatment in there. So now here's the magic. We're going to double click in this space and the spreadsheet opens. So I'm going to leave the fee the same, but I'm going to go down here and change the insurance benefits in this case. Let's make it $1,500. We'll be generous. Okay, I'm going to click outside that box. And you may not have seen, but these numbers down here changed. Okay, particularly the ones related to the monthly payment plans. Okay, because we only want to make payments on the part that's not going to be covered by insurance. Now you want to do this differently, that's fine. I'm just saying that's the way this is set up. If we now we made the change, click back in the document, there we go, we're right back here. And you can see the changes are right there and my calculations are all done for me. That's the nice part about this. Now again, in the case of Mickey, he's an Invisalign patient, and I don't mind doing 12 months interest-free in the office. You may want to do it some other way. That's fine. This is very versatile. You can make any changes here that you want. And you may want to have different versions for different types of patients in your office and indeed for different patients. So let's close Word here for a second. We don't want to save it. We want to go back here and consider Donald. Now, Donald, unlike our Invisalign patient, Mickey, Donald needs to have some regular dental treatment. And so I'm going to use a different payment options for him. The other thing about Donald is I'm just not quite so sure about his credit worthiness. And so I may not want to grant him the same sort of credit options that I did for Mickey. Also, he's going to be done in 2 or 3 appointments, where Mickey is going to be coming in for a year for his Invisalign. So here I am back here with my payment options. In this case, I'm going to select this one down here. And the same way, we're going to preview it. And now we'll see the payment options again pop up as a Word document. In this case, it puts Donald's name in there. Now I have to put the treatment in. So let's just say 2 crowns and 3 fillings. Whatever brief description of the treatment that you want to put in there. Remember before in the Invisalign, it was already in there for me. Now I'm going to go down. This just happens to have 5480 in there, but that's not the right amount. So let's change this number. Let's make it 3456. And he does have insurance, and they're going to pay $500. Okay. Now watch as I hit enter. These numbers are going to change down here because it's doing the math for me. Okay, now maybe that went a little fast. So there is the estimated patient portion. Notice the estimated is highlighted in red always. So let's go down to the number of appointments, because one of his options is going to be payment at each appointment in this particular payment option sheet. So I'm going to estimate he's going to take 4 appointments. When I hit enter, you're going to see these things down here, particularly down a little bit lower, payment at each visit. You're going to see that change. Okay, it's doing the calculations for you automatically. Now we can go back, click back here, and we say, okay, there's all our information there ready to give Donald, except Donald is not a senior citizen. And so having these options in here for senior citizens aren't appropriate, and they may just generate some questions. So let's go back in here again, and I'm just going to highlight these 2 rows and delete them. Then you can modify this on the fly. You could have a separate payment option sheet that didn't have those things in there too. You can do it any number of ways. So we click back here, and now we don't have something that's going to distract poor Donald. You can have a variety of payment options down here. You can have something for like quality dental plan. You can have different payment plans. You can have care credit. You can have anything you want, and you have several different payment options perhaps set up for your practice. So now what we do is print this, have Donald sign a copy that we scan and keep, and give him another copy, or have him sign the copy, scan it, and give him that copy. What we often do, though, with our signed copy is put some handwritten notes up here about what Donald is going to do, okay? And then we scan it. So that's how the payment options work. A combination of Microsoft Office and Microsoft Excel is not specific for any particular dental management program. In this case, I showed it with Open Dental, but it work with pretty much any of them that allows you to do a merge document, or you can do it completely outside your management software. So very flexible, very clear, very neat looking, and we have a variety of these on our website. You can pick the ones that best suit your office needs. Be sure you change your name up at the top so they don't send the check to me. Anyway, that's how payment options work.